All right, what's going on, everybody? This is Dr. Schilling from Skoy Health, bringing this week's Wednesday Wellness Minutes, and we are super excited to bring you this week's segment. Of course, you saw the title, CBD Oils, the next holy grail, question mark, if you've seen Anchorman, Ron Burgundy. Anyway, just a little joke there for the moment. This is a complex topic. There's a lot of information. I spent more time than I'd like to admit researching this. But I want to make sure I brought you relevant information that was concise and in a way that you'd be able to understand it. So here goes nothing. CBD oil. If you've heard of CBD oils, it's pretty much the hottest thing as of right now as far as pain relief and anything else you can think of. We had someone incidentally drop off today, stop in and say, hey, you want to sell our CBD oils? Apparently I've been spending enough time thinking about it that said enough information out there, people were like, oh, they must want to talk about it. Even Amelia's mother sells CBD oils. So there are several MLMs out there. There are a bunch of different companies. If you have a specific one you're looking at evaluating or using for yourself, you can feel free to send us an email with the link in the post or even the post below, and we'll give you some feedback on it if you want. It'll be the best to our ability as far as that goes. But let's kind of talk about what CBD oil, right? Most people think about CBD oils and they start thinking about cannabinoids and they start thinking about marijuana and maybe think about hemp and stuff like that. Really what it is it's a chemical compound that your body actually creates, all right? And they use an external one, or it's called an exogenous one from outside of the body, from the hemp or from the marijuana plant. And so people think about marijuana and think about, oh, it's such a terrible thing. Well, you have to dissect the plant into different parts. You have THC, which is what takes you high. Then there's the cannabinoid, or the cannabinol, that's going to be from the plant, but it's not the psychoactive one. It's not going to get you all high and stuff like that. So there are good things that come from a plant. It just so happens that there are psychoactive effects of the THC in the marijuana plant. But what's really impressive is there are over 400 chemicals that come from these plants, okay, from cannabis plants, 400 chemicals, 60 different ones, 60 different types of cannabinoids. So that's really amazing that one plant can contain all those different ones. Most of them are phyto, so they're plant-based, and they have a lot of what are called beneficial terpenes that help your body use them. And it actually affects your endocannabinoid system, so ECS. If I mention ECS, it's endocannabinoid. What's really crazy is that the pharmaceutical companies are getting all over this because they're finding that if they slap a CBD oil around, it's kind of like a liposome, this little fat molecule around a drug or something like that, it can actually cross what's called a blood-brain barrier. And think of your blood-brain barrier as like the gates of the fortress for your brain and trying to keep bad things out. And they're using it what's called a Trojan Horse. If you've ever heard that analogy, you read the story of the Trojan Horse. They're using it in that sense. So it's pretty amazing what they're doing with this technology. I mean, marijuana plants have been around in existence forever. Cannabinoids is becoming a new thing within the scientific awareness. But the big problem is that this is a big threat to a lot of industries, okay? So, I mean, hemp in general and things like that, lumber industry, food industry, energy, other industries like that, fiber industries like the hemp clothing and stuff like that. There can be 50,000 different products made from hemp. I mean, that is an enormous number. 50,000 different products, textiles, food products, building materials, bioplastic, nutraceuticals, the list goes on and on. But how do CBD oils work? So it's really important to understand basically they've isolated two main receptors, CB1 and CB2 in the body. And what's cool is the CB1 is what affects your motivation, your engagement, your emotional processing and stuff like that. So it's really helpful for people with anxiety and stuff like that. But there's a whole other realm of the CB2 that's affecting the immune system, the peripheral tissues and things like that. What I'll talk about in a minute as one of the potential areas of benefit is relating to cancer and how it can help shut off cancer and stop growth and stuff like that. So it's really fascinating. So that's going to affect the immune system. And so when you think about it, there's really promising things for anti-inflammatory as well as cancer and stuff like that. Delivery systems, some people smoke cannabinoids, vaping. They can go from transdermal, and it can also be drops and or eaten, just like hemp has been eaten and stuff like that. The challenge with a lot of the products like this garbage that was brought in today, I shouldn't say that, that's harsh. But I'll tell you right now, the dosage, just to give you an idea, you need hundreds of milligrams of CBD for it to be effective at a therapeutic level. This one has 0.6 milligrams. If you ever heard of the old adage of like a fart in the wind, okay, it's got, there's nothing, it's not touching anything. You're not getting any benefit from that from a CBD oil standpoint. There's 10 milligrams of hemp extract, but they're called aerial parts, which I'm sure there's a scientific definition behind that, but you really need to look into these products. If you're going to use them, you need to make sure that they are at a therapeutic level. And then you have to understand, like, is it going to be too much for me? And how to dose up and how to, like, sort of tread in the waters of CBD oils and say, how much can I put on or take before it, blows me out of the water? And we'll talk about some of the side effects and things like that, because it's really important you understand this. But we talked about CBD oil sources, hemp, the endocannabinoid system, and marijuana are 3 sources. But you also want to understand that anyone who's taking pharmaceutical medications, it's really important to understand that the potential drug interactions are significant. They can do with emotional things like benzodiazepines and calcium channel blockers. The antihistamines can be affected. It can go and affect your statins. So there's a whole list of drugs that can potentially be adversely affected or cause your body to have problems as a result of dealing with taking these cannabinoid oils. So you always want to use precautions when using any product that they don't have excipients, which are like added fillers and stuff like that. Avoiding heavy metals and things like that. Make sure there's some type of certification on the product that says it's heavy metal tested and there's nothing in there. Pesticides and contaminants, those are all problems for any product on the planet, given our modern society, our industrial culture. But it's also important when you're taking something in. Detox pathways. If you've ever heard of the cytochrome P450, the P450 enzyme in your liver, that's really important because CBD oils can affect that, and they can actually circulate your body longer because it can limit that enzyme's function. So, really important. So here's some examples of some of the toxicity experiences, or we'll call it the side effects, toxic side effects. It can actually decrease your coordination, make you, all goofy and unstable, decrease your muscle strength, make you feel lethargic, make you feel sedated or tired, difficulty concentrating, change your speech, reaction times. I mean, the list goes on and on. Tachycardia can give you a racing heart, dry mouth, potential diarrhea, changes in appetite or weight. That's like the tip of the iceberg. Then if you have the cross-reactivity, then you can have issues with foods and molds and mites and plants and all kinds of other stuff. It's like lions and tigers and bears, oh my. So CBD is dose dependent, and like I said, we need it for therapeutic. Over the daytime, you need hundreds of milligrams, but if you took all that in one dose, man, you'd be blown out of the water. So you always want to make sure you're not dosing up too fast and you're easing yourself into that. Some of the side effects, it's actually been shown in clinical studies that multiple sclerosis can have a relapse as a result of taking some cannabinoids or CBD oils. Drowsiness, inability to walk straight, that's called ataxia. Blurred vision, headaches, dry mouth, sedation, dizziness, conjunctivitis, conjunctival irritation, which is like the white part of your eye getting all red and stuff like that. Interestingly though, it has been shown to be beneficial against MRSA. Who knew? MRSA is methicillin-resistant Staphylococcus aureus, which is a whole mouthful you don't want to try and spit out. But MRSA is thought to be hospital-based infection, but it's actually everywhere in the environment now, just like C. diff. We're all exposed to it. These bugs are so powerful, you can't create a hyper-sterile environment because they'll find their way out and they'll mutate and they'll get stronger, and then we'll have road drug problems because that's what's happening with our antibiotic industry now, becoming obsolete. All right, things to keep in mind. CBD oils are not necessarily legalized from a federal level. Different states have different regulations that are allowing this to be sold, but then you have the interstate issues like marijuana and CBD oils. There's interstate issues for sales and stuff like that. So it's really important that you understand if you're going to buy something or carry something with you, it might be a problem for you if you get pulled over or something like that.